Hi, my name is Dr. Ren. I'm here to talk to you about frozen shoulder. Frozen shoulder are also known as adhesive capsulitis. Actually, in Japan, they call this 50 shoulder. So not everyone, I've seen it happen in people who are in their 40s and sometimes in their late 30s, but typically you got to be over 50 for this to kind of present itself. What it is there's a capsule of the joint that lies right into here, and it's a loose capsule in order to get that range of motion of our shoulder, how we can get it all the way up. And what happens is it starts getting inflamed and adhesioned, and that prevents that lifting. One of the first signs I see patients come in is they lift your shoulder and they start doing this, they start tilting their body away. So that's what basically adhesive capsulitis, it's just the freezing of the shoulder. Now, the thing about frozen shoulder is that it goes through 3 different stages. There's a painful freezing stage, and that can last up to 3 months, maybe even 9 months, depending on who you are. And we have a frozen stage, which is about 3 months long as well. And then there's a thawing stage. During the painful freezing stage, if we catch it early enough, you will reduce the time that you will deal with this condition from about 18 months without treatment to about 9 months in total. And we'll get that range of motion back so that you're only losing maybe a couple degrees range of motion versus not treating it all, and you can lose a significant amount. One of the most advanced technologies that we have for frozen shoulder is using shockwave to help reduce the inflammation and stop the adhesions from happening in the first place. So we apply this device to the capsule of the joint, which is causing the problem, in order to get it not to do what it wants to do, and that's freeze up. So we can kind of minimize that time during that freezing stage and not have as much or a significant loss of range of motion if you would if you didn't do those types of treatments. Most of the rest of the treatments we do is a lot of physical therapy. We want to get the strength and the range, we want to maintain the strength as it's going through these phases. And we also want to make sure that we're getting that range of motion to increase. And if we stay diligent with that during that freezing and frozen stages, that thawing stage, you'll just kind of go right through that really easy, and you'll have all your full function of your shoulder back. I'm Dr. Ren. I'm here at Ravenswood Chiropractic and Wellness Center. If you think you're getting a stiffening shoulder, come see me. Let's get that treatment started right away.